U.S., but I live in Thailand and grew up right near Orange County in Los Angeles. But so anyway, I've been practicing about 33 years now, and as Chitvan said, I practice integrative oncology, which means I use I take from all healing disciplines: Ayurveda, traditional Chinese, naturopathy, homeopathy, and then MD allopathy, osteopathy, all of them, because no one has the answer. Not one of them has the answer. They all have parts that work, and so an integrative approach is where you you actually integrate the best and the most effective from all the modalities, and that's what we do. And so I met Chitvan, I think 2 years ago or 3 years ago now. I was introduced by another physician in the U.S. who does similar type of work as I do, Dr. Sunil Pai. And anyway, I was amazed that anyone had addressed the microcirculation, because it's always been ignored. And the reason it's been ignored is because there's nothing you can do. There's no drugs. There are some studies that they use drugs, and you find out what these drugs do is they actually just reduce inflammation, and they're usually patented drugs, and you can actually get a much better result with intravenous curcumin and intravenous vitamin C than you could with these drugs. And plus there's no side effects, there's just side benefits. But that's all they do. They don't really deal with the microcirculation. But even though the endothelium of the microcirculation is what mediates inflammation, so in a way they're indirectly getting there. But again, they don't deal with the actual flow. So this is the only thing in the world that works, that does that. And if you knew me, you'd know that I abhor technology. I abhor machines. I think they are the beast. I think they are destroying the planet. It's a form of idolatry that the earth has never known. And anyway, but here I am with a BEMER, and so it's like, but it's the only machine I use. I don't like machines. I don't even like the word machine. It bothers me. I'd rather call it a device. But anyway, so with my patients, they come in stage 4 cancer usually. I'm lucky if they're stage 3. And they've had chemo, radiation, and surgery, and they usually come crawling in, and they've been told they have 3 weeks to live, a month to live. And of course, it's extremely challenging. So we do everything possible, and that now includes BEMER. And the way we have worked it into our program is that since it opens the microcirculation, which, so think about it, if we're giving a therapy intravenously and the microcirculation is shut down, it's going to shunt. It's going to go from the arteries to the veins, and it's going to miss the target. And the target is the tissues, the cells, So it wouldn't matter if I'm putting in the best therapy in the world in that vein. If it's not going to get to the target, then what's the use? So now they do the 8-minute session before therapy. So first what I do is I hydrate them. I give them, depending on their cardiac status, etc., I give them anywhere from 500 to 1,000 cc's of fluid, and then I'll do the BEMER, and then we finish the therapies, and then we do the BEMER again at the end. Some of them go on to purchase them so that they can use it at home for sleep, and use it during sleep as well, and let their other family members use it. But so it's really hard for me to say over the last several years what changes I have seen with it, because I've moved from the U.S. to Thailand. I'm always training staff. I've got many different therapies. It's all working, but it's all working better now. I've seemed to be having probably close to 68%. And if you think about 68% with stage 4 cancer, if you look at the data published in the Journal of Oncology in 2005, the data showed they analyzed the data from America and the data from Australia, and they looked at the prognosis of being alive at 5 years if you're diagnosed with stage 4 cancer. And in America, you had a 2.1% chance of being alive, and in Australia, you had a 2.3% chance of being alive at 5. So I don't know about you, but if someone told me that the plane I was about to get on had a greater than 97% chance of crashing, I probably wouldn't get on that plane. But that's in effect what it is. So anyway, to be up around in the 60 percentage with that kind of with that kind of diagnosis, those kinds of problems, is more than phenomenal.